Over the past 4 decades, we've witnessed a remarkable transformation in the fight against HIV/AIDS. Join me as we explore these revolutionary innovations and the profound impact they're having on the lives of millions. For many years, the cornerstone of HIV treatment involved a daily regimen of pills. Now imagine a world where HIV treatment could be administered just once every month or two. That's the reality for a growing number of people living with HIV, thanks to the development of long-acting injectable medications. These revolutionary drugs, like cabotegravir and rilpivirine, offer a game-changing alternative to daily pills. Instead of remembering to take medication every single day, patients can receive injections from their healthcare provider at regular intervals. This not only simplifies treatment but also helps to overcome barriers to adherence, ultimately leading to better health outcomes. Studies have shown that these medications are just as effective as daily pills in suppressing the virus and preventing transmission. By removing the need for daily pills, long-acting injectables empower people living with HIV to focus on their lives, not their medication. In the early days of HIV treatment, managing the virus often meant juggling a complex cocktail of multiple pills. Today, advancements in HIV medication have led to the development of once-daily single-tablet regimens. These remarkable pills combine multiple antiretroviral drugs into a single, convenient dose, simplifying treatment. With a single pill regimen, they can now take their medication just once a day, at a time that fits their schedule. By combining multiple drugs into a single pill, these regimens often have fewer side effects compared to older multi-pill regimens. The availability of once-daily single tablets is a testament to the ongoing progress in HIV treatment. For those who remember the early days of HIV treatment, the side effects of antiretroviral therapy, ART, were often as daunting as the virus itself. However, the landscape of HIV treatment has changed dramatically since then. Modern ART regimens are a far cry from their predecessors. Thanks to decades of research and development, these newer medications are designed to be more effective, better tolerated, and less likely to cause long-term side effects. This shift towards gentler, more tolerable treatments is a game-changer for people living with HIV. For years, the fight against HIV focused primarily on treating the virus once someone was infected. While treatment advancements have been remarkable, imagine a world where we could prevent HIV infection in the first place. That's the promise of pre-exposure prophylaxis, or PrEP, a revolutionary approach to HIV prevention. PrEP involves taking a daily medication that helps to prevent HIV infection. Studies have shown that daily oral PrEP can reduce the risk of HIV acquisition by up to 99% in high-risk populations. By taking PrEP as prescribed, individuals can significantly reduce their chances of becoming infected with HIV. The availability of PrEP represents a paradigm shift in HIV prevention. While daily oral PrEP has revolutionized HIV prevention, researchers haven't stopped there. Recognizing that taking a daily pill can be challenging for some, scientists have developed even more convenient and discreet options for PrEP. This dedication has led to the emergence of injectable PrEP, a game-changing innovation. In 2021, the first long-acting injectable PrEP, cabotegravir, was approved for use in the United States. This groundbreaking medication is administered as an injection every 2 months, eliminating the need for daily pills. Injectable PrEP offers a highly effective and discreet option for those who prefer not to take a daily medication. For far too long, women, particularly in sub-Saharan Africa, have borne a disproportionate burden of the HIV epidemic. Recognizing the urgent need for female-controlled HIV prevention methods, researchers have developed innovative tools that empower women to protect themselves. One such innovation is the HIV-preventing vaginal ring. This discreet and long-acting device is inserted into the vagina and slowly releases antiretroviral drugs over time. Another promising avenue of research is the development of microbicides. These are topical gels, creams, or films that contain antiretroviral drugs and are applied vaginally or rectally to prevent HIV transmission. These female-controlled prevention methods represent a major breakthrough in HIV prevention. By providing women with the tools to protect themselves, we can help to level the playing field and reduce the disproportionate impact of HIV on women globally. Despite decades of intensive research and billions of dollars invested, a preventive HIV vaccine remains elusive. The unique challenges posed by the virus, including its ability to mutate rapidly and evade the immune system, have made vaccine development a formidable task. However, recent breakthroughs in vaccine technology, particularly the success of mRNA vaccines against COVID-19, have injected new hope into the quest for an HIV vaccine. mRNA vaccines work by delivering genetic instructions to cells, prompting them to produce viral proteins that trigger an immune response. This approach has shown promise in early-stage HIV vaccine trials. Researchers are exploring various strategies to overcome the challenge of eliciting a robust and long-lasting immune response. Another promising avenue of research involves targeting broadly neutralizing antibodies, or BNAbs. While the road to an HIV vaccine has been long and arduous, recent advancements provide hope that a breakthrough may be within reach. While current HIV treatments can effectively suppress the virus, a true cure remains elusive for most. However, the scientific community is actively pursuing strategies to achieve a functional cure. One approach that has garnered significant attention is stem cell transplantation. In a landmark case, Timothy Ray Brown, known as the Berlin patient, became the first person to be functionally cured of HIV after receiving a stem cell transplant. Another promising avenue of research involves gene editing technologies, such as CRISPR-Cas9. This revolutionary tool allows scientists to precisely target and modify DNA sequences. Therapeutic vaccines represent another strategy being explored. The quest for a functional cure for HIV is a complex and challenging endeavor, but the progress made thus far provides hope. In an era defined by technological advancements, the digital revolution is transforming the landscape of healthcare, and HIV care and prevention are no exception. From telemedicine and mobile apps to SMS reminders and online support groups, digital health tools are playing an increasingly vital role. Telemedicine has emerged as a game changer for people living in rural or underserved areas. Mobile apps have also become indispensable tools for managing HIV. These apps offer a wide range of features, including medication reminders, symptom trackers, and secure messaging with healthcare providers. SMS reminders are another simple yet effective way to improve adherence to medication. Digital health tools are also playing a crucial role in reducing stigma and discrimination associated with HIV. The integration of digital health tools into HIV care and prevention represents a paradigm shift. As we've journeyed through the remarkable advancements in HIV/AIDS treatment and prevention, one thing is abundantly clear: the future is brighter than ever. Long-acting injectables and single-tablet regimens have simplified treatment. PrEP has revolutionized prevention. And while a cure remains elusive, groundbreaking research in areas like gene editing and therapeutic vaccines offers hope. But the fight is far from over. Challenges remain, particularly in ensuring equitable access to care and addressing the social determinants of health. Stigma and discrimination continue to cast a shadow. To truly end the HIV epidemic, we must address these challenges head-on. As a medical professional, I've witnessed firsthand the devastating impact of HIV/AIDS over the past few decades. The advancements we've discussed today are nothing short of remarkable. With continued dedication and collaboration, I believe we can create a world where HIV is no longer a public health threat, but a manageable condition and ultimately a distant memory.